window and click record to the cloud.
Okay. Was it going to take me back to the Zoom window, or did it just go back? All right.
There you go.
All right. Dr. Malone, here we are, April 22nd, 2020. And it's Wednesday afternoon, cloudy Wednesday afternoon in downtown Pensacola. I'll do a car count real quick. Yesterday we had like 11. And so 1, 2, 3, 4, 5, 6. North of us on Palafox. It's about the same as yesterday. It seems about the same as yesterday as far as traffic is concerned, maybe a little more traffic. I did notice in the news today locally that we had a little jump in the number of cases in town. Went from 300 and some change to 400 and some change, right? Did I miss that somewhere?
No, you didn't miss it. Yesterday, the county count was 340. And then today when they released, it was 418. And the long-term care facilities went from 71 to 102. So a large proportion were at the long-term care facilities, which I had understood that per the news, there was some testing going on at a couple of the facilities that had the infections from last week. So,
and if I'm not mistaken, Dr. Malone, was there one particular facility that was a little more prevalent with the cases?
I believe it was Southern Oaks, and I think that's where the state testing site or the state and the county coordinated testing site was ongoing on site a couple of days ago. So I guess seeing that jump in the numbers, I would deduce, I don't have any actual documentation of it, that a lot of those numbers are from that testing that was 2 days ago.
All right.
So
I've got, I saw Dr. Gottlieb. I follow him on Twitter. Dr. Gottlieb is a former, I think, either FDA or CDC official. And Scott Gottlieb, I think, and he's been sort of cutting edge on a lot of this data. Last night or this morning, I saw that he referenced the Santa Clara study that we had cited earlier in the week. And I think he was suggesting there was some bad methodology in that study. Did you look at that?
I did. And so that was, we shared that this past Friday. And then over the course of the weekend, the governor had also cited it with his talk on Saturday. And that was the one where it said that, in Santa Clara County, there'd be between 50 and 80 times the amount of people with the antibody, which means that the infection was that much more prevalent at one point. And in reading what you delve into the comments here, and it's a combination of like Reddit and then message boards, and these are like statisticians and scientists. And the easy takeaway is that the study may not have corrected for the false positive rate, meaning the confidence interval to show how good the test is, meaning it's going to find the infections, but it's going to not find, it's going to find the infection, but it's going to say you don't have it when you don't have it. You want true negatives. So there's false positives in there. And one of the breakdowns was this false positive rate wasn't corrected for to the point where a similar, like 10 times the amount of people could have had the infection if you had done the test a year ago. Because that's how bad it was. If you tested 3,500 people, they would have still gotten like 10 times before even knew coronavirus existed, meaning 1 calendar year ago. So there's some thought on that, and they're expecting that the authors would refine their calculations. And I guess the debated topic was that among the scientists and statistician group is they kept pushing forward, and now they're the ones that were behind the USC study with LA, saying that the numbers were elevated as well. So whether or not it's a statistical or mathematical error, or it's a problem with the test itself that they used, meaning the manufacturer of the test doesn't have a good quality test and it's picking up false positives, that hasn't been discerned there. But that's what Dr. Gottlieb was saying. That's not to minimize the fact that, there are people out there that were infected that we don't know about, that may be infected that we don't know about, but to what degree? And I guess Dr. Gottlieb was saying, take that with a seed of caution and know that, it may not be 85 times the amount, but it's still out there.
It's a significant number of asymptomatic people walking out there on the streets that have this virus that don't have any major symptoms. And that's what all the other studies that that have not been criticized in any way have concluded too. So
Mhm.
it's just a degree issue, not necessarily whether or not that's accurate as a principle.
Yeah,
Okay.
everybody agrees that there's asymptomatic carriers and there's people that were infected and never knew it, and trying to get a measure on it. There's, I guess, getting the accurate measure and to apply that then to large population or much larger populations to help determine, when you're safe and when you have things under control or contained. I think that's the goal of the study, and ideally, you'd like to get some reliable data that's done with like a good peer review. And I'll remind you that this was not peer reviewed when it released last week. So
Yeah. Well, here's let me tell you where I am with all this stuff. I'm getting frustrated. And let me tell you why I'm frustrated. Yesterday, we talked about a test that costs $118 that insurance is acting like they're not going to pay for, which pisses me off to start with. And then I said, all right, Dr. Malone, I was going to buy some for the office. And you said, well, no, Joe, you can't do it unless you're a doctor. I'm like, well, that's crazy. I said, all right, well, you get one then. And then you spent, I guess, several hours last night and today trying to access this test, willing to pay $118 or whatever the hell they're asking us to pay for this test. And you couldn't get one.
correct.
Is that right?
Correct. So
explain that.
Well, so this is what happens is you go onto the site and there's a whole questionnaire that you fill out, and you can run into like basically roadblocks that basically kick you out of the system if you answer the questions wrong. So I answered them wrong, and so I got kicked out. And it's intended to they're going with healthcare personnel first, so not necessarily all doctors, but anybody in the healthcare setting. First responders. So just having a degree doesn't do it for you. So you get kicked out there, and I guess it probably remembers your IP address, and that's one reason why I couldn't get back in. But then the other thing is, when you do get to the point of getting into the cart and checking out, then you have to provide your information, your exact name as it appears on your license. Then this test is then registered under your name at LabCorp in your locale. So then the test comes to you, you swab yourself, and you drop the test off at the LabCorp that they've specified. And when you drop it off, you provide your ID and say, yep, this is my swab, and I performed it on myself. So the way it's currently set up, you couldn't say, hey, I want to order 15 of these for everybody at the office, because it doesn't give you a result in the office. You still have to take it to the lab to get it done. So that's where they're at. And then I saw pretty much a same explanation by one of the officials that from the FDA this morning that basically said that, and I was sitting there nodding in agreement because I'd been through this yesterday until I was ready to bang my head against the wall.
Well, if I was going to protest somebody, I'd be protesting these companies that are making these tests and the government for not making these tests more available. Because I'd like to open my business, but I can't open my business unless I'm sure I'm not going to expose my people to each other if one of them has the virus. So if I could test all my people and get the results back in 5 hours, I could test them all Sunday night, and they'd all send me their results in 5 hours. I could let them all in the door on Monday morning. We could work at the office and, order lunch from one of the restaurants and, start symbolizing business downtown. But I'm not going to assume responsibility for somebody's life or their parents' life by just carelessly having them back downtown and, opening my office to clients potentially for this. I mean, it's crazy talk. I don't even understand how this is a phase-in process without testing. If we don't have tests, we can't phase in anything safely. You can phase it in, but it's dumb. 3 weeks from now, half of those people are going to be in the damn hospital. It's not half maybe, but a good percentage of those people are going to be in the hospital. If we use your numbers of the Americans that are overweight and have risk factors, 30%. So, all right. Yep. So where are we with the numbers where's the grade, the social distancing grade? I have a feeling it's a lot worse today.
The numbers, the grades today when I refreshed the browser were, because I leave that one open all the time. Escambia County was at a D, and Santa Rosa County was still at an F. So we've gone back down locally here. Statewide, it's at a C minus. So I don't see it going any much higher than the CD range, because we've never even smelled a B. And I think, like you had, I guess, the thought the other day that it's just going to go downhill from here as far as the distancing.
Look, I don't know who's doing the protesting and stuff, but I guarantee you there are people, it's a small minority of people. Everybody that I deal with, I know somebody that was out on the beach today taking some pictures of the Thunderbirds and the Blue Angels. And she was telling me she did an informal poll of people when she was out there. And she said she only talked to 20 or 30 people that were taking pictures of the Blue Angels and the Thunderbirds. And she said, I think she said 18 out of 20 something said that they didn't think the beaches should even be reopened.
Yeah,
I think people are more cautious than not with it.
Well, that's
because nobody knows what the hell is going on, and everybody's hearing that there's a ton of asymptomatic carriers. So, and then the politicians are like, "Oh, we got to open back up." I'm like, what data are you using for that decision?
Mm-hmm. Well, you talk about the informal poll. Well, Quinnipiac just released theirs. It came out like in the last hour that I saw the news alerts, and 72% of Florida voters don't want social distancing rules eased before May, while 22% disagreed and said that they do.
Before May 1st?
It says before May. So that was the way the question was posed for this poll. So 72% of Floridians say don't reopen yet.
All right. Let's play this out. Let's say the movie theater reopens tonight. Let's take a poll. Who's going to a movie? I mean, what the? I mean, I don't know. Maybe there's a bunch of young people in there, 20-something-year-olds going to the movies. That's pretty much it. People that just think they're invincible anyway. Maybe the same people that drink and drive and get in horrible car wrecks. I hope that's not the case, but that's, for purposes of our society. Anyway, this is again against my business interest. I mean, we average 20 to 30 brand new car wreck, careless driving cases a week, and we're around 2 or 3. And I've talked to a couple of lawyers that do what I do locally here, and they're in the same situation. It's not in my business interest to be saying this stuff. Do you understand? And I'm saying it because it's in the greater interest of our community to not have people out and about right now. Not until we can test everybody or most everybody and find out what the heck's going on. The governor, I was exercising at lunch and I saw a replay part what the governor of New York said, Governor Cuomo, and he said something like, test, trace, isolate. Test, trace, isolate. So he wants to test folks. And he made a good point. He says, if you have all the tests in the world to give out, you still can only process so many per day because the labs and the machines that do the process. And so they calculated that the most they could do, I guess, in New York State per day was 40,000 tests per day. He goes, so you can have 100,000 tests done in New York State, but all they can test and process is 40,000. So he says, we're going to assume you do 40,000 a day, and we're just going to use 40,000 tests a day. And from that, we're going to do testing, tracing, and isolation. So 3 words that I really have never put together in my life, had any reason to, are now something that I think about. It's like reuse, recycle. What's the other one? Reuse, recycle.
Oh, I don't know, the 3 R's or something like that.
Yeah. So I'm sure somebody can correct me on that, but
It's like
but
a kid's song or something like that. But yeah,
yeah.
reduce.
Reduce, reuse, recycle. Yeah, thank you. And so now it's test, trace, isolate. And so, you know, he said that's the way you are going to figure out how much of society and this economy you can reopen once you get a handle on the testing, tracing, and isolating. And if you have a good handle on testing, tracing, and isolating, and you find hotspots and you figure out how big the hotspot is and you shut it down, then you can have some security in opening the other parts of the community back up. Because in large part, I guarantee you this little virus attacks one little area as a hotspot, and then one person from that hotspot gets out into another big event, and it just gets all out, right? If we don't have any big events, it should stay somewhat isolated, so we can isolate it or trace it and isolate it. But if you start having full-on theaters and churches and concerts and whatever else, you're going to lose control over the ability to do that test, trace, isolate, because it's not going to be so widespread. It's not going to be possible. Am I wrong to say that?
No, and I guess I liken it to these controlled burns that they do in our area. You know, you usually hear about it ahead of time. Everybody has the warning. They know to watch out for it. And the people that are doing the controlled burn, they know to watch for when it becomes uncontrolled, so they can tamp it down. They have the means and the resources. And
Right.
so that's kind of what you just described there is this needs to be a controlled burn, because it's going to burn. You get that, but you don't want it to be uncontrolled burn. So I guess that's the only thing that pops in my mind as far as a way to draw that similarity for people to maybe grasp onto.
Okay. What other things do you have for us today?
So they had the walk-up testing in over in the Addicts Court, I believe, today. So no screening required, and I saw that they had tested 255 individuals, no screening. So you know, I guess we'll be interested to see where those numbers come out.
Wait a minute. So we could walk
2
up
days.
theoretically to this thing and just get tested?
Yeah, and that's what I said. So the Community Health of Northwest Florida, that used to be the Escambia Community Clinic, they were opening up the walk-up sites, and the first one was today. It was like in the morning hours. It was like 4 hours or something like that, and they tested 255 people. And the next one is Friday morning at different location. I had it up here.
Are they going to publicize the results of those tests?
Well, they have to be reported into the state or the county data, but will they say, hey, of the 255, this is what we had back? I don't know that that's going to be publicized, like what percentage came out this year. So today had the walk up at right here, the screening walk up. Yeah, Addicts Court was today 9-1, and then Friday is at Morris Court and Sanchez Court 9-1. Walk-up testing in these communities is open to the public with no pre-screening required. It doesn't say how they're going to be reported, but I do know that everything I've read, they need to be reported into the county system and the state numbers. Whether or not they'll give us the lump and say, of the 255 that we tested Wednesday, this is how many came back, you know, positive, negative, whatever. So we'll probably see the numbers. I expect that we'll see another leap out there, because you would think that there's going to be some selection bias there. The people that wanted to be tested are curious to know, you know, hey, I've not been feeling well, or hey, I had a direct contact or whatever. Maybe one of their loved ones is one that's been either hospitalized or in one of these other, I guess, local hotspots like the long-term care centers. And so maybe they're going to pop positive now, and it's information that they probably already knew, but we're just going to put a measure on it. And I wouldn't be surprised to see another jump here, where, you know, to see another 30 or 40 cases come out of that.
Right. Okay. Well, we'll watch that closely. What else do we have today?
And then the other local thing is, I guess now, county-wise, we're like number 4, number 5 in the entire state as far as long-term care facilities. It's kind of tight in that it's like, yeah, like we made a leap with that jump up to 102. So that's not a good grade to get passed up to.
We're the 4th or 5th highest
County is,
long-term care?
yes, as far as the county, yeah. And I mean, the other ones are like South Florida, but yeah, we jumped over a few of these other ones that were kind of hovering just above us with the sleep. So yeah, that was not good news.
No.
So that's what I had there locally. And then I guess there's no movement as far as opening the beaches. I did see that the hospitals came on board, and I saved what their letter, the contents of the letter. I guess all the 3 hospitals locally said that they're in favor of opening the beaches with restrictions. And you tell me if you think they can enforce these restrictions, because
Let's hear
I
it.
don't. Groups still need to gather in groups of less than 10 and maintain 6-foot distance from one another.
No,
Those coming from
can't do
those
that.
coming those coming from
Next.
hotspots into the local community need to self-quarantine for 14 days upon arrival.
Yeah, that's not going to work. What else? Next.
This is the third thing. Officials need to continue to monitor confirmed and presumptive cases and reevaluate the situation as necessary. So they could throttle back.
Okay,
So those are the
what
3
about
stipulations.
the pandemic manual you showed us yesterday about loosening restrictions? They reference that? That's
Nope.
a pandemic manual from the Department of Health and Human Services, right?
Yeah.
Which I think somehow hospitals should be aware of in some respect, right? I wonder if they've looked
Yeah.
at that. Probably not. Maybe not.
Nope.
Obviously not, because they are putting out these just random benchmarks. That's what it sounds like. Oh, what if we said this? Would that sound like we're in favor of something that some of the public might like, and that way we can appear like we're trying to be helpful? I mean, why? You know what the hospital should be saying? How many ICU beds do you have available? And if I'm a hospital, I'm looking at admissions. Here's how many admissions I've had today versus yesterday that relate to COVID. And I've seen this kind of it go up, down, whatever. And as soon as I start seeing it tick back up, my idea is that something's not right. But if I'm a responsible hospital, I would be certainly suggesting that testing is something that should be employed before you just open these places back up.
Yeah, I just got a news alert. I was waiting for this before we went on because it was a little bit late. So they updated the afternoon numbers. They usually do them about an hour ago. So long-term care facilities were up to 138 now.
From
102. We went up to 138 over the course of today. It was 102 this morning.
Oh my God. Is it that one place, Southern Oaks?
It doesn't say, but this is on PNJ. I just got the news alert. 138 cases. Escambia County is now the 5th highest number of cases, tied to long-term care facilities in the state.
How irresponsible is it for a hospital to say anything about opening anything up with this kind of situation? It just sounds irresponsible. Of course, I know hospitals are irresponsible already. I mean, we wouldn't have medical malpractice cases based on hospital conduct if they did everything appropriately. At the end of the day, a lot of these facilities are looking to make a buck. So, all right, let's talk about this. What do you think we should take away from the fact that this long-term care facility issue keeps doubling every day?
Well, I think these people that are infected, assuming that even a portion of them are residents of the facilities, their mortality rate is going to be, I think, significantly different than someone who's not in these facilities. So I think we're going to see a jump in the amount of deaths too, locally.
Okay,
and it's going to be people who are residents of those facilities, and as tragic as it is, it's not sensational to the point of, hey, a 35-year-old young healthy person in the community, a school teacher died or that kind of stuff. So you're going to hear about it, and it's sad and tragic, but it's going to be, it could be just as bad as what we first reported or saw reported out of Seattle, where there was 40 deaths in one nursing home, and people were like, oh my gosh. And so now it's par for the course.
How many people tested positive from Southern Oaks before this news alert came while we were talking
The-
today?
They never specified. The state just released the list of 11 facilities, but never said how many were at each
Oh.
facility, or how many deaths. Because keep in mind that 7 of the deaths in the county are tied to the long-term care facilities as well.
All right.
So
what
they
about
never,
staff? What about
they never-
differentiating between staff and residents? Nothing?
nope. They never had that. The big thing was just disclosing the names of the facilities. And I'm telling you, like the one that I saw reported was that Southern Oaks had the on-site state or county coordinated testing. And so here we jumped, last night we jumped from 71 to 102. And then over the course of today, we jumped from 102 to 138. So in the last 24 hours, we've added 70 cases. We've basically doubled the long-term care facility numbers.
What was the, which facility was it that was asking the state for help on how to wear a mask? Like 3 weeks into this thing.
Yeah, that was with the emails that came out. It wasn't Southern Oaks.
No.
I'd have to pull that up.
I'm a little concerned that the reason we don't have these numbers sooner is because the testing was so delayed. And they're just getting around now to testing all these people. But plus, if you got to figure, if it's a 2-week period while the disease can be, there before it manifests with symptoms, the latency period being that long, I guess you figure some of these people might have been exposed to the virus up to a week or 2 weeks ago. I guess that's possible,
Yeah.
right?
Yeah, they could have been, and that was, when we talked about last week, where the email changed, said, hey, we need help. Our staff needs to know to be properly fitted for masks, and I told you, and just the discussion between you and I, the horse has left the barn.
Yeah.
So at one point you were keeping track of how we were doing, like numbers wise, on a piece of paper.
Oh yeah, I still have it.
All right.
It's actually 1.5 pages now. I've had to go to page
Okay.
2.
What is going on if you look at the numbers from the beginning of this to present? If you add in what we just found out in this news alert, what does it look like? Are we plateaued? Are we going down? Are we still going up?
So I would say that we saw a small plateau, maybe like around tax day. There was a small plateau there, and then we had a leap year over the course of the weekend into just now these numbers this afternoon. So we plateaued.
So we're back on the upswing.
Based on these numbers, yeah. And and I had made mention that we were having a positivity rate with the tests that were being conducted and the test of positives. We were hanging like right in the 6% or 5 to 6% range, depending on which day you looked at. And now, like, our overall test rate has been dragged up to 8% since it started. So that means like the last couple of days, the test rate has been like more than 10% positive.
Huh. Okay. And do we have updated numbers on the number of ICU beds that are occupied by COVID patients?
They never said how many were occupied by actual infected patients. They're just releasing how many ICU beds in the county were available.
Mm-hmm.
So of the what they said, actually they never said ICU beds. Let me take out of the ventilators that were available. They had 220 at any given time, and they said as of yesterday 175 ventilators were available. So what is that difference being used for? They never said, hey, between 175 and 220 is people that are infected with the virus. They never said that. And then of the 1,300 and change hospital beds, and that's all comers, not just ICUs, that there was roughly almost 600 beds available. So those numbers, those have been, I've been seeing those every time they release them, and there's not a whole lot of movement there.
Who cares about a regular hospital bed? I mean, that's not going to do a whole lot.
Yeah,
you're going to need a ventilator if you get this. If you start taking a downturn in this with this virus. All right. So where in the vaccination, we talked about vaccinations last night. That's in 12. That's I guess a 6 to 18 month process, depending on if there's challenge trials and all that we talked about yesterday.
Yeah, and there's a conglomeration of private and public entities that are really trying to coordinate more than they ever have before on these things. Obviously, these vaccine manufacturers are in it to make some money, and the only way they can do this is that they make enough money to pay for it. But I think there's more of a cooperative collaboration being conducted, and there's actually like a whole protocol that I ran across that they were suggesting that these facilities use on sharing information with one another. So,
All right. I saw something about the hydroxychloroquine. Is that what it's called? Causing some deaths or some research actually it wasn't as helpful as originally thought.
Yeah. So that was the small VA study, and I don't have that pulled up to go right now. I can get that for maybe later or for tomorrow, but again, not peer reviewed. So take it with a grain of salt, as we said with all these other ones that are similar. It said that they didn't notice a large benefit, and they suggested that perhaps these individuals fared worse than had they not received the drug. I will say that VA studies do have an inherent selection bias as far as the population that they test. So the VA population is generally older, generally male, and also has comorbid conditions. So it's not to say if the drug wouldn't work in a different population. So I think if I learned anything, maybe it's not ideal for that population, but it's not to say it doesn't work. And I would say that for any of the drugs, whatever they studied. So I'll have to pull it up and dissect that for us.
Are there any new treatments or medicines?
There are. So let me pull this one up here. I had this one ready to go. Let's see here. So this was. This is the FDA writing a letter to this company saying you can now use your new device. And the name of the company, they have this apheresis system, okay, which is basically blood filtration. So they're saying we can filter your blood for people who go into that cytokine storm. So right here it says, people admitted to the ICU with confirmed or imminent respiratory failure to reduce pro-inflammatory cytokine levels. That's the use of the filtration. So think of it as a form of dialysis, though it's not dialysis, but that's the closest equivalent I can allow for people to maybe draw to. But this, they got this approval for blood filtration to add to the armamentarium of, kind of. So,
it was sort of a speedy kind of process for them, right?
Yeah, and I assume that they already had the technology in place and had already been, studying this or trying to come up with an indication for it. I will add that following this, I looked around enough, and they're anticipating that the next pinch, we heard all the pinch is going to be on ventilators, right? Ventilators. Well, now all these nephrologists are saying, well, the pinch is going to be on these dialysis machines because we're dialyzing the same amount of people across the country that we always do every Monday, Wednesday, Friday, or Tuesday, Thursday, Saturday. And now we're getting an inordinate amount of new people in ICUs who are acutely ill, who have an indication for dialysis, either renal failure or rhabdomyolysis or Guillain-Barré, that they're all finding resultant of with or of the COVID. So if this machine falls into that same use, meaning you still have to have a technician who runs the machine, you may have to have some of the same machinery. So I don't know how accessible it's going to be, but that is something that's new as far as new approval for use.
And it's hours on the machine itself.
Yeah, and generally, if you're in the ICU requiring that is staff that needs to be there to run the machine or to monitor it. You don't just plug it in and let it go. You have to have someone actually sitting there monitoring this kind of a machine to see how you do. And then your nursing staff is also in there taking care of you. Then you have a respiratory therapist. So it adds to the whole milieu. As far as the other treatments locally, I did see Channel 3 reported Dr. David Daly, the infectious disease doctor at Baptist, had indicated that Baptist was using some of the hydroxychloroquine in some of their appropriate cases, and also one of the antivirals. And didn't specify if they had had poor outcomes or anything like that, and said it was too early to tell as far as the antiviral, thumbs up or thumbs down, if you will. So things are being implemented locally, and it sounds like, according to the interview he gave, it's not just, itchy trigger finger, like you walk in the door and you're given the stuff. These are people that are in extremis and out of options. So they are doing that locally.
Okay.
And then let's see here, what else was I gonna, I guess I can show you this. This is out there as well. We'll link all these things as always. So this one here, the American, so the Infectious Disease Society of America has come up with this very easy to navigate management tool on what to give people. Let me close this cookie thing. I don't know if I can, oops, of course I can't, let's see here, there we go. All right. So basically say, under what situations would you, as a physician, you'd be administering these medications. Recommendations 1, 2, recommendations 3, 4. And so it's out there. And this is when the Academy, the Infectious Disease puts this out, or Society of Infectious Disease puts this out. I think it's pretty authoritative, and perhaps some of these physicians like Dr. Daly in our community is, perhaps referring to something like this and saying, yeah, this is why locally at Baptist Hospital we're doing the hydroxychloroquine, or we're getting to use the antivirals. So we'll go ahead and link. Well, it's pretty easy to follow.
Those recommendations are sequential. In other words, you're supposed to use them in that order.
I think no, they're just the sequence. The numbers aren't sequence. It's just the way that they've rolled them out, because they keep adding to them. So here's recommendation number next, and here's recommendation number next. It's not as you march along with this ill patient. Okay, this is your next option. I don't think that's the way, because it's if you can do 1 or 2, that's great, but you may be going right to 7 or 8 depending on what the patient's situation is and what the capability of your facility is. And then let's see here. Oh, so then I wanted to bring this up. And so we talked about this way back when I was still in office with you. We talked about
6 weeks ago, 6.5 weeks ago.
Yeah. So we talked about cleaning stuff, right? Don't mix bleach with your ammonia, right? Well,
oh yeah,
we
talked about that. I remember we did a thing. We did something on that, a video or some kind of post.
Yeah. So here we are, the Centers for Disease Control early release. I had to get this out there because I want to let everybody know. So here's So 2018 and 19 are pretty level, like every month, every part of, yep. And now here we are since March 11th. There's been an increase in calls to the poison control centers in regard to exposure to cleaners, cleaning solutions. And then over here, that's disinfectants, same thing. And they put two case scenarios in here. Case scenario number 1, there's a woman who mixed bleach solution, vinegar, and hot water, left it in her sink, and she said it smelled like chlorine. She ended up going to the hospital. She recovered, but that's the exposure. We talked about the chloramine gas. And the other one is basically a school-age child.
A point on that one before you leave that one.
Yep.
It sounds like they were in her sink, which means she may not have even intended it to mix. It gets down in the P-trap or whatever.
No, she filled the sink.
If they don't fully run through the piping, they mix.
Okay, so let me read the whole thing then. I guess I should have just. Okay. So right here, she heard on the news that you can clean your recently purchased groceries before consuming them. So she filled her sink with a mixture of 10% bleach, vinegar, and hot water, and soaked her produce.
Oh Jesus! Oh my God!
Okay, so and then here's the next one.
People are scared to death, though. I mean, it's hard to blame her. I mean, geez.
So here's the other one. A school-age child was found unconscious in the home. She got dizzy, and they found an open 64-ounce bottle of ethanol-based hand sanitizer.
Oh my God.
And she got admitted with a blood alcohol level of 273, and a normal level is 80. Well, I wouldn't say normal. There's no normal level of ethanol is 0, but as far as state limits, 80. So she didn't have any injuries. Apparently, she recovered in the ICU, So anyhow, their
Wait, how did she
takeaway
ingest
is,
that? Did it get in her skin, or I don't understand that part?
no, she drank it.
She drank it.
Yeah, she ingested an unknown amount of this stuff.
Oh my God.
So, so the takeaway is this. They're saying
Don't make
that,
your own sanitizing products at the house.
well, they're saying exposure to cleaners and disinfectants has substantially increased since early March 2020. Associated with increased use of cleaners and disinfectants is the possibility of improper use, such as using more than directed on the label, mixing the inappropriate stuff, and not wearing protective gear and applying it in a poorly ventilated area. So they're basically saying, read the directions, don't do stuff that you're not advised to do, and obviously watch out for children, keep them out of reach of children. But I mean, when the CDC is putting this out as an early publication because they see that black line jump like that, I mean, that right there is without being infected, that is a result of the pandemic, these kind of
Wow.
things.
Yep.
And talk
No doubt about it.
Well, and we talk about, hey, if you're sick, go to the hospital. If you're having chest pain, go to the hospital. Don't avoid it because of the pandemic, but don't put yourself in a position that forces you to go to the hospital, an unavoidable position like this, or I mean, unavoidable one rather, sorry. So that was those. And then the last thing I'll add, and this is, you had mentioned already, and this it caught my eye, is right here. American Medical Association is requested that they look into basically the civil liabilities being limited during this vulnerable time. So,
Well, that's an interesting concept.
Civil immunity. Yeah. So they're saying that there needs to be some civil immunity, the federal, state, and local directive, including but not limited to those that cancel, delay, or deny care as a result of the COVID pandemic, or limit care, I'll say. So anyhow, so the AMA, the AMA penned that letter, and that was today.
Here's how it works in real life. In real life, first of all, malpractice cases cost between $200,000 and $300,000 to bring. So there's only very few that we take. When we take them, we evaluate the case based on the entire circumstance, not just that something happened and it was a bad result, but we take into account what situation was the physician in at the time that this happened. And was the physician acting heroically when this happened? And because the jury who makes the determination at the end of the day, if the jury thinks the doctor's performing heroics to save a life, they're not going to find against the doctor, even if the doctor makes a mistake during the heroic operation. The idea that we need to tell the doctors in advance they can do whatever the hell they want and you're not going to have any liability for it, I don't think it's necessary, because in reality, no jury's going to find a doctor liable for anything they're doing under these circumstances, even some things that might be reckless, to be honest with you. So I don't think it's necessary, and I think it's a license to basically do whatever they want, and I'm not sure that we need it. And speaking from somebody that handles these cases every day, and only a select few of them are even worth even bringing in regular times, nobody is going to touch and invest $250,000 into a malpractice case under these circumstances for ordinary kinds of mistakes. Okay, period. End of story. And the idea that you're going to tell them in advance that we're not going to do that seems like you're giving too much up in your rights at this point. So long and short of it is, I think it's unnecessary. So I can go on a soapbox for hours on that.
Yeah.
But, you know.
Yeah, that one caught my attention, and for good or bad, it was something I knew that you would definitely be able to provide more insight on.
All right.
So that's what I had for today. I'll look into some more of the breakdown of the couple of things we talked about earlier, and come back with some hopeful citable and reliable information.
You know, I'm real concerned with the businesses being reckless with their employees. And I just don't think it's a good idea to be forcing your people to come back to work without some kind of testing protocol in place. So that's my 2 cents on it. I think it's irresponsible for our public officials to be encouraging groups of folks to get together in theaters and wherever else, if that's even on the table. I think that's wrong until there's testing in place, widespread testing in place. Dr. Malone tried to get a test for him, he couldn't do it. I would like to get tests for all the office. I'll pay for it. I can't do it. It just seems like until we can do those things, we're shooting in the dark, so to speak. So
you're driving without your headlights on.
Correct, and that's not something we are fond of at this firm. So speaking of that, we're absolutely working for our clients still. Everybody's remote except for a couple of people in the office, and including myself. And we are signing up new clients. We're settling cases. We had a mediation today via Zoom. We didn't settle that case, but we made some progress on it. And we had a couple other meetings on Zoom today with some potential clients. And we had an inspection at a home today that we did actually, we did it in person with one of our lawyers.
Social distancing.
We had social distancing in place and masks. So we're being somewhat responsible. And fortunately, it was an outdoor kind of event. So we didn't have to get too close to anybody. But in any event, we're still working. If you need us, you can find us on the web at zarzaurlaw.com. You can always call us at 855-HIRE-JOE. We'll be back tomorrow with another edition or segment of this series, if you want to call it that, on the COVID virus. We appreciate Dr. Malone, who's a board certified internal medicine physician, sharing his medical take on a lot of these subjects. You can comment below here if you have questions on that. And we want to wish Michelle, and Michelle works in our staff, and she's our marketing manager, and her and her husband are celebrating their 25th wedding anniversary today. So
if the video
in charge of this process,
if the video looks a little bit off, then it's
celebrating an anniversary.
Yeah.
So
it's because we're running the show.
Happy anniversary to Mitch and Michelle. 25 years is a long time. I told her today, I used an expletive. That's a blank long time. Okay. Of course, this is a guy that couldn't, if I added all my relationships together, including the one that I'm gloriously involved in now, I'm not sure it would equal 25 years. But it's more about me than it says about other people. I know that much. So in any event, good night. We'll see y'all tomorrow.